Hello everyone. So it's like I said in previous videos, and I'm going to say this. I told you so. US takes steps to prepare for a pandemic as global coronavirus cases are rising. So it is now here, and I've been saying this. And so I just read some really crazy articles that have relation to the coronavirus. And, for one, they say that there were protesters that were blocking a bus of people who, I guess, they were trying to, get these people off the bus. Supposedly they cleared of the virus. But then it's conflicting news. And then I seen where they basically, which I believe these are true, these articles are very true, where they say that one woman, she tested positive for the coronavirus and she spread it to 5 family members, relatives, and she was asymptomatic, meaning she showed no symptoms. And then another article that was stating that they're afraid that the people who they had let go in the U.S. and cleared after 2 weeks may be carrying the virus still and could infect other U.S. citizens. So then this article comes out saying that U.S. is taking steps to prepare for the pandemic. Now it's saying a pandemic. At first it was careful not to say that because they didn't want people to freak out, but because now they know that it's here in the U.S. and that people are turning up with it. They're now saying that it is a pandemic for the pandemic as global coronavirus cases rise, because it just seems to hit folks left and right. So as the global concern over the coronavirus outbreak grows, the U.S. is taking steps to prepare for a possibility of a pandemic. So the CDC, which is better known as the Center for Disease Control and Prevention, said this on Friday. And so health authorities are closely monitoring the spread of the virus, because a virus, there is no cure. And I've been saying that. It's just like, they've been trying to find little cocktails and little things that can be vaccines, but viruses, there are no cures for them. So health authorities are closely monitoring the spread of the virus, not only in China, but where the outbreak had began and where the vast majority of nearly 77,000 cases have been diagnosed, but also in the growing number of cases in other countries as well. I even heard that there's some people in Iran that have gotten it, and they can't understand where it is coming from. The only thing I do know that they've stated is that it has to do with people that do a lot of traveling from these different countries. And it says here, but also the growing number of cases in other countries. By definition, a pandemic is an epidemic on more than one continent. And so that's why I said early on, it is fitting the bill. It fits the description, in other words, as a pandemic. So South Korea is being hit with it as well. So in South Korea, officials said that cities were facing an unprecedented crisis as the number of cases have doubled in a single day. So the rising to more than 200. Many of the infections diagnosed in Korea are linked to a single church service that they had now. So I don't know if you guys were paying attention, anybody looks at this, but there was a church service that they had. And it looked like a wedding or a church service. And so in the midst of this pandemic thing, the coronavirus, and I'm going to say pandemic because that's what I think it is. And I also think it has something in there. People are going to refute this. They're going to say, oh, you're roaring up the fears. But to hit so many people in such a short span of time, that sounds like somewhere in a lab somebody screwed up and they tested some stuff on animals, and then in those countries where they have a black market on animals and they sell these animals, it makes a lot of sense. And people eat these animals, and they consume it. So whatever the animal is sick with or has ingested or has been tested with, you are putting that in your body. And then there could be a whole number of other ways people can get it, from other human contact of people who also have contracted the virus. So I feel like, if it's there and if it's accessible, where people are coughing and sneezing everywhere, and, are they eating some infected animal, there's many ways that you can get it. And it seems as though they were trying to say it wasn't as easily spread, but I believe it is easily spread because so many people are getting it. So many of the infections that are diagnosed in Korea are linked to a single church that they had this service, said officials who urged residents to stay indoors as much as possible. But on Friday, Lebanon diagnosed its first case. Okay, so, and the Iranian health ministry has confirmed that 18 cases of the illness, including 4 deaths, have occurred. So in the U.S., the number of confirmed cases rose to at least 34. And so that's how it starts. It starts where there's just like a few people, and then it starts to gradually grow as people spread the virus. So as a number of evacuated individuals from the Diamond Princess cruise ship have tested positive, several of the Americans who were on board of the ship have been diagnosed and hospitalized in Japan, according to the CDC. So as of Friday afternoon, there were no plans to evacuate those patients. Now, here's where some people messed up. So the U.S. Department of State said that it will rescue other Americans who choose to go on cruises in Asia. Okay, so apparently Trump was upset because they had released some people who were under quarantine, and I believe they let them go too early, not really knowing full well if they were actually fully cleared of this virus. And so these people have been supposedly released back into U.S. soil, and now they're brought over here, and that's what caused the ruckus where people were upset. Protesters like, don't bring these people here. You don't know if they still carry this virus. You're going to spread it here in the U.S. and it's going to take off like wildfire. You're going to have a lot of deaths, casualties. And so that's why the people are mad. And now they're making this headline saying that there's this wave of Asian racism. People that are racist against Asians. I don't really feel like that. I feel like because people know that the epicenter was Wuhan and it happened to be in a country that was primarily Asian, that is why people have these growing fears. And so when they see someone from those places and they see them coughing a lot or they're looking like they're really ill, they're fearful because they're not fearful of the person just by who they are, but because of who they are in terms of where they came from and what happened over there is what's got people freaked out. And so they're not saying this. They're trying to make this thing into a race thing. But I'll be honest with you. Living out here in California and in the cities, I'm just going to put this out here, and I know a lot of people don't want to be truthful and they don't want to say what's really going on, but the laundromats, the liquor stores, now most of the developers that come over here and build all of these high-rise luxury buildings, people that put and invest a lot of money in these properties, most of the times, usually they're Asian because they tend to have a lot of money and invest in properties and keep things within their own culture. But if it's a person of color, in other words, a black person that tries to get hired there, very rare do you see them opening their doors to hire black people. And so if you want to speak about racism, I don't think that Asians are not, there are some Asian people that show in what they do. It's more what they do that shows the homogenous of everything, wanting to have it with only in their own culture, and building up this money and not really wanting to hire blacks, and they already have this preconceived notion that all of us in terms of black people are thieves, and so they harbor racism as well, is what I'm saying. And so they make it seem like this group of people, they're squeaky clean, and they don't have any racism in their body. And so I have seen personally, there have been black people who come into the store, and if you don't have any money, or they assume you don't have any money, they're watching you. They want you to get out of the store, and they'll kick you out. They'll fight you, and then they have a gun behind the counter, and they can't wait to shoot you, especially if you're black. And so if you want to talk about racism, then let's be real here. There's some Asians that harbor a lot of racism, especially towards the African American community, and that's the reason why some of the 92 riots reflected some of that. So if you want to go there, we can go there, but in the U.S., the number of confirmed cases that have rose to at least 34, going back to this article, as a number of evacuated individuals from the Diamond Princess cruise ship have tested positive. So several of the other Americans who were on board of the ship have been diagnosed and hospitalized in Japan. So according to the CDC, as of Friday afternoon, there were no plans to evacuate those patients. So the U.S. Department of State said it will rescue other Americans who choose to go on cruises in Asia. Okay. So such repatriation flights do not reflect our standard practice and should not be relied upon as an option for U.S. citizens. So Ian Brownlee, an executive within the Department of State, said that during a media briefing Friday on its website, the department has warned Americans to reconsider any planned cruises to or within Asia, saying, now you could look at that and say, oh, that's racist. That's racist, because I even thought when the Trump administration was closing the borders to Nigeria, because Nigeria was called the Black China, they wouldn't say why they were doing it, and it did seem racist. And I would say it seemed very racist. But then on the other hand, all of a sudden, boom, this, and I'm going to say it, pandemic, this coronavirus broke out, and there was an outbreak. They knew it was happening. They just didn't tell us about it. They knew it was happening, and they knew it could also happen in those countries where now Nigeria does lots of business with the Asian business people. And so there are Asian people living in those countries. And so there's the assumption that with the traveling back and forth, that these people might have come in contact with this virus. And so that's more the issue rather than the people itself. It's where they're coming from, and that outbreak was centralized there in Wuhan and maybe some of the other places. And then two, there was something else that I was listening to that they were saying that several stories that, this thing about it being a bioweapon is, far-fetched, and it's conspiracy theories and this, that, and the other. But a lot of times whenever it's something big like this, they keep it quiet for a while and they talk about all these other topics, celebrities, clothes, Oscars, all these other things, and they don't tell you the truth. And they wait until a large number of more people die. And like I said, they wait. Now it's in the U.S. Now wait till somebody famous comes down with this virus, because famous people have to travel. They have to get on planes. They have to go travel so they can make movies and do, photo shoots or whatever they do. Famous people travel. They don't just stay in one place stationary and then don't fly and travel. They have to go to different places if they're making movies, and they're going to be in certain scenes and things like that. So Wait till one of the famous people gets it and see how serious people start to take this thing. Because I don't think it's as serious that it's not being taken as serious. Because people want to believe that, oh, it's not a pandemic. Oh, it's just a small number. Only 30 people got it. Now, when they see that number from 34 rise to 34,000, or famous people start getting it, then it's going to be considered something serious. And then you'll see more people jumping on board. Oh, this is a pandemic. How did this happen? Oh, we can't blame any one country. But if you're eating things that are infected with something and that have no nutritional value whatsoever, and that some lab could have been testing, it makes sense. There are bioweapons. There's things that are in labs that they know that are chemicals that can just wipe out countries, wipe out thousands and thousands of people. I wouldn't be surprised, like I've said, and I mentioned this, that, it's a top secret thing and they keep it quiet and they do it because they don't want the public to freak out. But this stuff is bad. It's really bad. And notice, here's another thing I want to bring out before I go back to this article. Do you notice this is supposed to be, I believe, an election year? I don't hear any of the candidates talking about this virus. I think they've been instructed not to say anything about it because they want you to focus on electing these people in hopes that they're going to create a better tomorrow, and they don't want you to talk about this virus. And so they're staying off that topic. They've been on the topic of economics, this, that, and the other. But think about it. This virus is affecting economics. Right now, China has lost some of its business, and it's not doing too well. And some of the workers, I'm hearing they can't, if not some, many of them can't get paid. A lot of those people are angry out there because they feel like they've been lied to, that people have been holding back from them, not been honest and not been forthright. They silenced the people over there. There was a doctor that was over there, and he tried to warn about how quickly the spread of this virus was. And that government tried to silence him, and now he's dead. And so I'm saying in terms of the defense for people who happen to be in that circumstance over there, that I'm hearing that it's not a pretty sight, that they're understaffed in those hospitals, those clinics out there in Asia, and that the people are just sitting there waiting to die. And they're not letting us see this as the American people. They lie to us too. And so if you want to go beyond the race thing, I believe seriously that it has something to do that was chemically made, and also that it was injected in animals, because they do this stuff with medicine. They do it with a lot of things. How to cure cancer, how to cure AIDS, how to cure all these things that they know they couldn't really cure everything. But what about making weapons that are bioweapons, things that, if you want to fight against another country or another group or enemy, that you can just drop something in the water, or you can just put something in an area and watch it spread. Just like, and I know this is going to even seem more far-fetched, but do you notice that in Africa, there's so much AIDS out there, and you don't see anybody really doing much about it? The people out there have all this AIDS, and they're dying of that, and they've learned to kind of adjust to it, and either you live or you die, or you live with it. And that has come out here where they've had all this advanced medicine where people can live longer with that virus and show no symptoms. So now they got this coronavirus, and they were trying to do all of these little tests in the lab to see if they can put even the HIV medicine and some cocktail together to try to create a vaccine. I don't hear much about that yet, but I heard that was something that they were working on. But notice that that's where it's centralized, in these labs. So what if somebody, I'm just saying, for, somebody gets pissed off, they don't like who's in who's running things. They don't like all of the stuff they're hearing about all this change. And they're mad at just anything. Are they just a vindictive individual, and they want to see a lot of destruction. And so they create it by making something like this bioweapon, and it clusters. It just takes thousands and thousands and thousands to multiple to the people out. And so, one group at a time, It's not far-fetched. It may seem far-fetched to people who are skeptics, people who don't really read, or they just go on their everyday life not thinking that anything can happen to them. They don't think beyond, 5-10 years down the line what's going to happen in this world. We already have this issue with climate change. We have the issue with, the wage gaps, workers that, could not be paid, fairly, and, people that are working in American society, and they're getting low wages, but they're having to pay more rent, a third of their income, just to survive. And believe it or not, I'm also reading something yesterday, I think it was early this morning, that they were trying to shut that up too. That people who are trying to get a green card and people who have no documentation status in the U.S. may find it hard if you're on public assistance, if you have a housing voucher, because they're trying to, right now, pass a bill, which I believe it's going in effect as we speak, that if you have any of these governmental assistance programs that you're on, and you are a person trying to achieve citizenship, or you're trying to achieve a green card, that it will affect you because you're looked at as a public charge. And I had been saying that, and they were saying, oh, you're not going to be a public charge. Even don't buy into that. See, they want as many people on these public assistance programs so that the people working there, they get paid. You're a customer to them. You're helping them keep their jobs. But when you guys get scared and go into the shadows because you read and you find out that they're setting you up, because think about it. They got your name, they got your address, they got your family, they got your social security, what country you came from. They can round people up anytime. Somebody could be knocking on your door and round you up and then cart you on off. And now you find yourself, you wind up in a detention center. You notice you don't hear too much about that anymore, do you? They've kind of quieted that down. And I wouldn't be surprised now, because I've been also hearing that even in the prisons of those countries where the coronavirus is rapid, that the prisons, it's now in the prisons, the coronavirus. Because those people are in that area and they can't be quarantined and go anywhere. They're in the cell, out of the cell, go back to the cell, go to a cage outside, and go back to another cell. They're basically stationary in those buildings. So the prisoners are getting it. And I wouldn't be surprised if the prisoners out here in the U.S. begin to get it. The nurses, the doctors, the clinics, schools where teachers are working at, you already have teachers that are vulnerable of getting sick because people bring the kids with infections and things like that. And so now we have this. And so if people are coming from these countries traveling, we don't know if your grandma, your uncle, your auntie came from these countries. And so, yeah, I don't always agree with Trump's policies, but, I do, however, agree with him being gruntled and upset about them releasing people not knowing whether they're clear from this virus or not, because now you're releasing it into the American public, which it has now happened. There was somebody in San Diego that wound up with it, and I believe they might have died or they're near death. A couple wound up with it. They were released from, I think, the boat, and they tested positive for it. So they've been letting people go too soon. And these people have it. And so it says here, that on its website, the department has warned that Americans to reconsider any planned cruises to or within Asia, saying such trips may be impacted by travel restrictions affecting their itineraries or ability to disembark, or may be subject to a quarantine procedure implemented by the local authorities. So a number of U.S. Coronavirus cases is almost certain to grow. Do you hear that? As the thousands of people who traveled recently to China and are quarantining themselves voluntarily in their homes for 14 days and monitoring their symptoms. So you have people who recently gone to those countries and they have voluntarily quarantined themselves because they're trying to see basically if they're going to catch it. Now, how many people do we know who those are? Who might have went to the store? You're around a lot of people when you're in the store. You're riding on a bus. You're around a lot of people when you're riding on the bus, or you're in the subway system. If you go to some public establishment, you're around a lot of people. And so those people are innocent people that might wind up with this virus simply because of the selfishness of these people that won't listen to what seriousness there is of millions of people probably getting this stuff. Anytime you got that many people into the thousands that can get this stuff, it can go in quickly into the millions. Yes, it can. You know, if you don't have, you're not going to have enough nurses and doctors to help all those people. It's unreal. It's unrealistic. It just is not going to happen. The numbers keep rising. The less resources, the less help people are going to get. And the people they're going to try to help are the ones they pick that they think are either the most popular, or the most favored individuals, or the people that have the money are the ones that they're going to try to help first. And all these poor people and all the people that don't have any money, or the people who don't have any medical insurance, are the last of the litter. And that's how it goes. It's just, that's just how it is. So the number of U.S. coronavirus cases is almost certain to grow as thousands of people who have traveled recently to China are quarantining themselves. It says that. And so a system appears to be working. A traveler in Sacramento County, California, was under a self-quarantine, was confirmed Friday to have the coronavirus. You see that? Now, before he quarantined himself, where did he go before that? Before he decided, you know what, I'm going to voluntarily quarantine myself. But did he go to the grocery store? Did he ride on a bus? Did he go somewhere where a lot of people were? We don't know. We don't know. So the system appears to be working, they claim. Yeah, until we find out that more people have it. So the patient who has not yet been included in the CDC's tally of 34, see that? They're not even, that tells you right there, they don't even know the numbers of people who have got this. How many more people? It isn't just 34. They make the number seem low because they don't want us Americans to worry. But the numbers are actually higher than 34. Probably more like 340. Or maybe 3,400, maybe. Might be a good number. We don't know, but we could assume because it spread so quickly. So 34 had mild symptoms, is what they say, according to the Sacramento County Public Health. So still the CDC is preparing in the event that the outbreak gets worse. In the event that the outbreak gets worse. Okay, so we are reviewing all of our pandemic preparedness materials and adapting them to the COVID, which is the coronavirus disease 19. Okay, Dr. Nancy Messonnier, director of CDC National Center for Immunization and Respiratory Disease, said Friday during a media briefing using the name of the disease caused by the coronavirus. And so the material will serve as a blueprint for the community's intervention that we will use here in the U.S. That means reinforcing infection control procedures, making sure healthcare workers have enough supplies, and planning for a possible influx of patients. And so it'll be just like Wuhan, where they have this huge hospital and all these people saying that they're going to help, and they're going to run out of people, run out of staff, because the numbers of people, the cases are going to grow, and they're going to run out of whatever supplies that they have to help all these people. Okay, I feel like somebody put this out here for a reason. It was plotted and put out there. Somebody screwed up in a lab, but they kind of knew that if it gets out, oh well, who gives a fuck? They deserve it. And somebody was in a lab doing something they shouldn't have did to begin with, and it was top secret, and it's out, and now we're supposed to not know anything about it. Now that it's out, now they're trying to clean themselves of it and say, oh, we don't know where it originated at. Because what that says to me is you don't know where it originated at, because you do know where it originated at, and you just don't want people to know where it originated at. Because you know, if they find out that it's the government's top secret bioweapon, that what will end up happening is that people will even have more distrust in the government than they already do. That it's a possibility that somebody might have been angry, pissed off, and they didn't just screw up, but they knew what they were doing. In some retrospect, they probably thought, if it gets out, it gets out. They deserve it. Oh, well, let's see what happens. And so then that's one scenario I'm saying, which could possibly be the case. The other is testing animals and injecting them with the shit, giving them this disease, this virus, and trying to see what it causes, and then dumping the animals, the dead carcasses somewhere, and then people who are just in it for the money, and they're on the dark web, or they're doing a black market business for wild animals and gamey animals to sell them as delicacies, so that crazy people who think, oh, I'm super rich and I don't have nothing else to do with my fucking money, so I'm just going to spend it on eating wild boar, or wild pangolins, wild bats, because I'm super rich and I can eat whatever the hell I want. Nothing will happen to me. It tastes delicious. It has no nutritional value whatsoever, and it's got some diseased up whatever labs shit in it, and you eat it, and now you're sick from it. And so that's what could happen. And so this is another scenario, which is not uncommon that this stuff happens. I mean, like I said a couple of years ago, I was watching a documentary where there were a group of people, and when you mentioned pangolins, nobody wanted to say anything. They all looked like, like a deer in headlights. They all looked, like what? Pangol what? But you had to know a code word or code name to get the person who is basically in the racket of selling those types of exotic animals as dishes. And so you get them you buy it, and I believe it's worth a lot of money in those countries. And then when you give up your money, and you can afford to, it's like these people profit. They're living in an impoverished country, and doing this is putting food on their table. They're able to feed their families. They're living next to nothing. They're living in the dirt, in the dust. So yeah, they're gonna do that. What do you expect? And so they sell this off to some buffoon who's got a shitload of money and nothing else to do but eat this wild stuff. So he can claim that he had this exotic wild dish from some exotic country. It doesn't seem far-fetched to me. But anyway, it says, even here, it says that the materials, going back to this, it says, the materials will serve as a blueprint for the community interventions that we will use here in the U.S. So that means reinforcing infection control procedures, making sure healthcare workers have enough supplies, and planning for a possible influx of patients. Even here in California, they have hospitals geared up if they see people come in with this virus. They know what's going to happen. They've been already alerted by the U.S. government that this is a pandemic and it's going to spread. But people, just the civilians, have not been alerted, except but we've been given like the little crumbs of bread of information. You have to read between the lines. So can the coronavirus be contained? That is the question. How countries are able to contain the virus and prevent it from sustained person-to-person transmission will be important in determining the ultimate end game of the virus. Dr. Anthony Fauci, Director of National Institute and Allergy and Infectious Diseases, told NBC News. So if the infection control gets out of control in many of these countries throughout the world, when it's going to be very difficult, or then it's going to be very difficult to prevent cases from then going by travel to all parts of the world. Okay, so in other words, they're saying if it gets out of control, which I believe it will, because they already can't keep track of the people that they claim that they quarantine and they let them go. That's why the Trump administration's upset about that, because they're letting these people go not knowing if they're actually well or not. And then there's an article that said that you don't even have to show symptoms and you can still be carrying it and give it to other people. This one lady, she had relatives. She gave it to 5 of her relatives in that short a span. That's crazy. That's crazy. And so it says that as a part of a team of the international scientists led by the World Health Organization and the National Institute of Health and CDC have staff members in China observing containment and infection control efforts. So they're scheduled to travel into the epicenter of the outbreak, Wuhan, on Saturday. And so we still believe that we can contain the virus. Director General Dr. Tedros Adhanom, and I cannot say this other name, said that Friday during the media briefing, but the window of opportunity is narrowing. It's like a forewarning. They're saying the window of opportunity is narrowing. It's like they're letting you know that this could get crazy when it already has gotten crazy. And they're just preparing us to know this is going to be crazy. And so get ready. Get ready, you guys. And so here, you see the people with their mask on. You see how people look. It's going to, you know what's going to happen? It's going to get so crazy. This world is going to become something different. You're going to see people that are walking around with masks, people that are walking around with spray. They're going to be spraying folks and things like that. It's going to change our whole society if it goes the way I'm thinking it's going to go, or possibly could go. And so there's going to be some areas that are going to be hit more than others. And other areas where people are going to act like they want to live in a bubble because they're in fear of it. And then there are going to be angry protesters because they were not careful about who they let out and who has this disease, this virus that so easily spreads that many people could die of this virus and get sick, deathly ill and sick of this virus. And it's just scary. And so this is the kind of thing that they're not telling us. And that's the thing that should be upsetting people. People should be enraged because your babies, your future is hanging in the balance because you are not being told the truth about this particular, what now they want to use that word pandemic, which they were trying to stay away from in the beginning. And they should have been saying that all the while. I'm going to let this video go, but I don't think this is cool at all. I think this is something that they should have been talking about long before, and they're not doing a good job of really informing the American people of the fate of the world and what is going to happen. And it's not even here just in the U.S. It's all over. It's in Iran. It's in the Asian countries. It seems like that's, why do you want to sit up here and lie? Why would they sit up here and lie? We knew that the first time we heard it, it was in Wuhan. That's an Asian country. Oh, let's not be mean to the Asians. Let's not say mean stuff about Asian people. Nobody's saying that. We're scared. That's what people are going to act on their fears, and rightfully so, because they know that so many people over there in that particular place have died of that virus. So yeah, people are going to be angry and they're going to be mad and they're going to be targeting. They're going to see people. If you look like you've been over there in that country and you are coughing all over the place and sneezing all over the place and you look like you're sick, yeah, they're going to be scared and they're going to react. You're mad at the American people because they're afraid of dying of this virus that you won't tell us about, that you have waited to say that it's actually a pandemic when we always knew that's what it was. Anybody with half a brain knows that that's what this is. And moreover, possibly a terrorist weapon. But somebody fucked up in the lab, and now the shit is out everywhere. And so innocent people could die of this because of somebody's anger. We don't know. Oh, because somebody's negligence, or because somebody has a shitload of money and they want to eat some crazy wild animal because they want to prove that they have all this money and they can afford to do that. We don't know where the hell this has come from. Could come from all of it, as far as we know. But what we do know is that a lot of people are getting it, and a lot of people could die of it. And that is the reason why people are afraid and they're reacting. Don't be mad. Don't judge people because they're in fear. Because you have unleashed something that it doesn't even, you ever heard of the death sentence? You don't even have a death sentence. With this, it sounds like you don't even have that long to live once you get it. You're just counting the minutes when it gets worse. And you don't know, depending on your health issues, if you're older, whatever the deal is or how it reacts on your system, you're here today and you can be gone tomorrow. Having said that, thanks for listening.